In the news this week, Western Australia's Chief Health Officer reveals an optimistic future but warns youth against complacency.
Indigenous activists criticise child protection legislation, calling for a royal commission into government group homes.
The obesity epidemic in WA dragging down moods and the healthcare bottom line.
And on Western Perspective, how a new generation of hobbyists is discovering models.
This is the Evening News with Ivan Learn and Sarah Smith.
Good evening. As WA is spearing ahead in the fight against the coronavirus, our Chief Health Officer is warning young people the achievement can be undone and constant vigilance is the only option. During an exclusive interview, Dr. Andrew Robertson also gave an insight into his experience of working with decision makers and how certain health policies came about. As soon as the lockdown measures are being relaxed, there's a sense of relief within the community. But are you able to tell us what are the risks if people do not follow the rules?
Well, the risks are that we will have the disease either introduced back in the community. So a lot of our border controls are very important, or we may have outbreaks within the community, related to other cases, and no system is perfect, and no border controls are totally perfect. So what the risk is that those cases will enter the state, and as people are mixing more, there's more larger gatherings, there is a risk of bigger outbreaks. So we have to be very careful about managing the risk going forward, otherwise we run the risk of having another wave, second wave.
What do you have to say to young people who just don't care about the rules?
Look, the rules are about protecting them, but they're also more critically about protecting their friends and family. And they may not think that the rules are important, but it is around the interactions that we have with each other. So every day we go out, and if they're going out to visit friends or that, they're interacting with those friends, and then they're meeting people as they go to work or go to sport. And if they become infected, it may not impact on them greatly, but it will impact on others within the community, and that might be family members, it might be friends, and if we get a major outbreak, then we will have to consider whether further restrictions are required, and that will certainly impact on them.
With the implementation of the 4 steps plan being announced,
yes.
Step 2 is coming this week. So what should Western Australians be aware of? Because it does look like normal, but it's not. It's not.
So in phase 2, a lot of there's a couple of focuses, but one is opening up the borders to a degree, so that is to allow a bit more travel so people can go into the southwest or the Great Southern. If you're in the Pilbara, you can go down into the Gascoyne or the Midwest, or if you're in the Kimberley, you can move across. So an ability to travel, ability to obviously catch up with family or friends, or take a bit of a break in one of the other areas. So that's one of the steps. The second one is around opening up, trying to start to open up restaurants and cafes, and that was a deliberate effort to try and do it. Now, some cafes and restaurants are frustrated because they sort of say, well, we can't open for 20, but we have to do this in a staged way.
So what does the future look like for you, particularly when it comes to the level of spreading or the future outlook of the virus in WA?
Look, I think it's an interesting phase of the virus. We're obviously in that phase where we've managed to get it under control, both in WA but largely across the country. And we're in a far better position than many other countries. But the virus hasn't gone. It obviously is still very evident around the world. So we've now in this phase where we need to try and open up society to get it back to working, because obviously it's having a serious social and economic impact, get it back to working without getting any further significant outbreaks of the disease.
And you can see the full interview on Western Perspective. That's coming up in 5 minutes on this program. Changes to the Child and Community Services Act have raised concerns from ethnic groups within the wider community, particularly Indigenous communities. They believe this bill displaces vulnerable children without greater family intervention. Reporter Taylor Hanna has explored it further. Taylor, what more can you tell us?
Yes, Sarah, the amendments to the Child and Services Community Act will see an enhanced application of Aboriginal child placements and reforms for better outcomes for children in state care. These recommendations come after the Royal Commission into Institutional Responses to Child Sexual Abuse. But Aboriginal spokesperson Mervyn Eads said there will be less consultancy between the Department of Child Protection and Families, resulting in greater concerns for displaced children.
And we can't have this no more. We cannot give greater powers to a system that's already broken and failing. It's just not right. We're setting our children up to fail.
The department will only need to consult with one person in order to remove the child from their family home before being placed in the system.
For what? The kids are loved, they're cared for, and that, and we just do not want this amendment to go through, and we will fight and contest it as much as we need to.
However, with the bill already passed, Mr Eads is calling for the government to repeal the amendments and to commence a royal commission into the treatment of children in the system.
Failing, the system is broken. The child protection system is broken. We have children coming out of the system more damaged than when they went into the system. So what they are calling for in the amendments is greater powers to remove children. Remove children to where?
Back to you, Ivan.
Taylor, thank you. Schools will be getting back to normal this week as the state government resumes mandatory attendance for all students. From Monday, those who are absent without valid reasons will be marked as unauthorised and will not be provided with online home learning packages. The Education Minister says that parents can be confident in the state government's decision-making process.
Those students who have medical advice that they are unable to attend school because they or someone in their family is medically vulnerable will be supported to learn from home. The review of schooling arrangements was based on health advice, educational research and feedback from education stakeholders who were consulted with this week.
WA's local councils are gearing up for a soft reopening of business this week. In Kwinana, the local sporting grounds will begin to reopen for groups of less than 20 people, as will the city's aquatic centre. Residents wanting to use the library and community centres, however, will have to wait until June. Mandurah City Council is reopening their aquatic centre with a maximum capacity of 20 people, and the city's libraries and community centres will also be available for some socially distanced services. Kwinana Mayor Carol Adams says that the council is looking forward to a return to normality.
At the end of the day, we're here for our community and we can't wait for everything to be back to normal.
A new report has sounded the alarm on the cost of obesity in WA. According to the report, body weight related issues cost the health system $340 million in 2016. By 2026, the cost of obesity will be $610 million. Dietitian Margaret Hayes says that the impact of obesity goes beyond physical, and it's important for people to know that weight management can be more complex than realised.
We've got this concept that it's energy in, energy out. Well, on a simple equation level, that's correct. But when you put complex emotions and moods from people and life situations on top of that, it becomes a very complex situation.
The much anticipated report into Hong Kong police brutality was released this week. Although the report identified areas of improvement, it has ruled out any systemic problems. The report also rejected allegations of the force's collusion with armed gang members. The Independent Police Complaints Commission blamed the violence on hate messages online from the conflict. However, it's worth noting that 5 policing experts chairing the inquiry quit last year, stating that only more power to the IPCC could establish a meaningful report. US President Donald Trump has revealed that he is not in a mood to have direct conversation with China President Xi Jinping, at the same time threatening to cut ties over the COVID-19 crisis. During an interview on television, he said he was disappointed with China and claimed that cutting ties would save the US $500 billion. The Chinese government has denied the accusation, saying that all the data was given to the World Health Organization as soon as possible.
Despite hard times ahead around the world, Cystic Fibrosis has taken their fundraising efforts online in honour of the Cystic Fibrosis Awareness Month. With 56 Roses campaigns going virtual, raising money for vital services and research is still as important as ever. A challenging transition from a once physical event to an online experience has seen months of preparation. But Mr. Barker is hopeful that the uptake will be even greater.
We've created a virtual rose which we've put online at rosegarden.org.au, where people can go and they can buy a rose, they can dedicate a rose, or they can gift a rose to someone that they love. So we've already raised over $10,000. We've got a $100,000 target, which I'd really like to hit. Already the news is spreading around the world. We've had donations from the United States and from the UK. But what we'd really like is we'd like Australians to get behind it.
And that's our weekly news and current affairs. We have the latest news on our website and social media pages.
Until 5:30 next Sunday, look after yourself, stay at home and have a pleasant evening.
Take care.